Hello, Bruce. How are you?
I'm doing great. How are you doing, Raj?
Fantastic, fantastic. So you're in California today.
I sure am. Yeah, Santa Barbara, California.
Excellent, excellent. Thank you. Well, I'm in sunny. Well, it's not that sunny, but I'm in Thunder Bay, Ontario today, and there's still snow on the ground.
Is it? Okay.
Yeah.
All
So,
right.
so thank you very much for taking some time out your very busy schedule to join us for today, and to share some of your thoughts and opinions, especially around the COVID-19 crisis. And I understand it actually has a personal dimension for you.
Yeah, that's right, Raj. I should share with our audience that for me, this has gotten very personal very quickly. It happens that our son is living and working in Milan, Italy, right near the hardest hit area. And of
Okay.
course, he's working from home at this point, and we talk to him just about every day, but we're really concerned about him and our other relatives and friends in northern Italy, including my cousin, who is a hospital doctor there. Raj, Italy, like the U.S. where I am, and Canada where you are, is a G7 nation. It's among the world's largest economies, has the vibrant, democratic, open society that's very hard to channel and control. But it's been forced to take these extremely strong measures to contain this horrible virus. So one thing I'd say to your listeners, if you and your employees are not already adopting the best practices that have been promulgated by health authorities, please do it now. The tragedy really needs to be contained.
I understand, and I'm certainly hope things work out okay for you and your family, especially with your son being in Milan. It's right, he's right in the centre of it right now, so it's. I understand it's pretty tough times for you guys.
Yeah,
So,
but we're making it through.
talking about the industry that you and I have been in for a number of years now, what can you share? What advice can you share for contact centers regarding this pandemic? Then.
Yeah, okay. Well, first of all, what I see in the industry is a lot of concern. There's a certain amount of panic, and fortunately, also a lot of really good leadership that's helping centers adjust to the new reality. My antenna went up in February when, after a chat with our son in Italy, I realized, there's a need for useful information in the rest of the world for contact center managers. So I wrote an article entitled Coronavirus and Your Call Center. Don't panic, plan, and prepare. And I was overwhelmed with the reception the article received. And it made me realize, Raj, that there is a hunger for good information
Hmm.
from contact center managers. And then, when on March 11th, the World Health Organization declared the global pandemic, interest really went through the roof. So everyone's looking for a way to deal with this new reality, triaging CX as best they can to try to keep the wheels on.
Yeah, I understand, and thank you for sharing that with us, and some of that content with our readers as well. So, do you also have any other advice, Bruce, that you can share regarding this?
Yeah, Raj, we had a Call Talk podcast episode with Dr. Charles Fency, who's a community health expert. And I'd invite your listeners to download it free from the resources section of the Benchmark Portal website. Totally non-commercial, just good information. Dr. Fency, who's a great guy, talked about social spacing in the context of contact centers that are oftentimes made up of tightly packed cubicles. We talked about the efficacy of masks and 4 cubicles that have sides that maybe are only a couple feet high, the possibility of adding clear plastic vertical extenders between cubicles on all 3 sides, and then using disinfectant liberally. In other words, trying to come up with ideas that actually people can use instead of
Right.
the usual just wash your hands a lot. And a key point here, Raj, is that the social spacing of 2 meters or 6 feet feels really uncomfortably unnatural for most people in most cultures. And that's especially true for a lot of young people. But people have to stop shaking hands, hugging, talking too close, etc. But Raj, we're all call center managers, right?
Hmm.
So we know what behavior modification is all about. We do that through QA and coaching all the time. So I'd ask the viewers to think of it this way. This coaching may save lives. I'll repeat. This coaching on behavior modification may save the lives of people in your center and their loved ones. So my advice is to make this the first and the last subject discussed in all of your team meetings for the foreseeable future. Be a
Right.
nag. It it may take that to get people to change. So if you care about your people, be a nag. Make sure everyone in your operation keeps their distance.
So with that in mind, about what other advice would you give about communicating with the stakeholders in the business?
Yeah, well, of course, one of the things you have to do is to review your business continuation, and if you haven't done that already, and make sure that your stakeholders are all part of that. Do you guys have multiple call centers that can be made redundant? You have an outsourcer to whom you can funnel calls if your center gets locked down in some fashion. But consider this, that stakeholder, your outsourcer, may be hit with the virus too, or with some government order. So you have to take that into account. And do you have at-home agents now? Can you make everyone an at-home agent? Managers should consider the demographics of your center. So if you have a lot of aging baby boomers with a lot of underlying health risks, you need to be especially protective of those people. In terms of communicating, as you said, it's really important. Get plugged in with your local health authorities. This is a piece of advice I haven't seen anybody give so far, but it is important. One of the things that Dr. Fenty talked about. Don't wait for the authorities to contact you. Plug in ahead of time. Get to know them, where they are, who they are. Let them know you're there and can be part of a bigger plan of action for your community. And keep in mind, too, that if they have some resources, governmental resources to offer, they'll know you're there and can help you out. So make them one of your stakeholders. Another thing is, how do you get people to the nearest health facility quickly and safely? This is something I haven't heard anybody talk about either, but what if somebody on the job in your center develops symptoms of COVID-19 on the job?
Yep.
Well, don't wait till that happens. Plan for it now. And you should also be, in terms of other stakeholders, Raj, communicating proactively with senior management. Let them know what your situation is, when your needs change. Communicate, obviously, proactively with your employees about what to expect. Uncertainty is the thing that all of us hate.
Yeah.
So if you can ease their minds to know that you, as a leader, have things under control, that's really important.
There's some good suggestions there, and thank you for those. And we're talking about what to do within your contact center, but there are some organizations where they're in complete lockdown mode and they're having to push out agents to work from home. What sort of technology do you think is key for for those organizations if they have to go down that route, they're forced to go down that route?
Right. Okay, well, the answer to that is technology that works and that can be ramped really quickly. This is characteristic of a lot of the in-the-cloud providers who are able to make their apps available to at-home agents really quickly. As you know, many centers have already moved to cloud-based systems and are exploring those options. Some have cloud-based systems but have never actually used them for at-home agents. Now's the time to do it, obviously. And if you're in an area that's not immediately affected or impacted, then do your pilot on that. Take 10% of your agents and do it now to make sure you understand how it works and how you can make it work well. Now, some of the premise-based ACD systems also have features that allow at-home functionality. But you know what the problem can be right now, Raj, is that, getting bandwidth from a supplier is tough. The providers right now are really swamped. So I was just talking with an independent provider who got the University of Washington. Washington State is sort of the first epicenter in the United States. But he got the Washington Medical Center's premise-based via ACD to work with his solution. And they had agents working from home in a matter of days. So things can be done if you know where to look. If somebody needs help in doing that, I'm happy to help out if someone's in a bind. But those technologies do exist. Hopefully you've got them already and have deployed them. If you haven't, if you have the technology, do a pilot right away and really see how you can make that work for you.
That's good. That's good.
Yeah. There are some things, though, on that, if I could just mention, too, that there's some issues that people don't talk about enough, and that is, do people have the appropriate home environments, the internet, all that sort of thing.
Yep.
And so you need to target who could go out immediately and who can't. In some countries, it may be fairly easy to have everybody go home. In other countries, maybe half of the people could go home because they have the appropriate home environment to go to. but in those countries, maybe the other half would be coming in, and but spaced, more in terms of the cubicles. All of these things are possibilities, and the technology, make it your friend. Make sure that it helps you out here.
Yeah, so some good advice there as well, Bruce. So that's certainly taking care of the technology aspect and the environmental aspect. What about training and coaching?
Yeah, right. Okay, well, training is another huge issue. If your training is appropriate for at-home agents and you have a really good knowledge management system, then you can add that to a good chat platform and dedication to monitoring and providing regular feedback during these really difficult times. Then if you have all that together, it's good. So you need to do the training. Don't assume that your in-house training is going to automatically work for new agents who are coming on board. Have your learning specialists look at these things and make sure that they're really done properly for the at-home environment. And you need to have policies and procedures. It's not just doing it, but also sustaining it and making sure that the training and coaching works to acculturate your at-home agents the same way your brick and mortar team is acculturated. Does it make people feel part of the organization? Okay. And you have ways of doing that through training, team meetings, fun contests, all the stuff that you do in brick and mortar centers, you should be able to push out into the at-home folks. And, if I could just add one thing, Raj, that once the emergency triage is over, look to actually improve CX, not just preserve it. So I would encourage people to use this opportunity as an adrenaline rush, which it is, that could in fact push you to higher levels. Put it out there for your people. Be ready to support and encourage it, and see if you can come out stronger in terms of skills and morale than when you went in. As a leader, you want to turn this negative into a plus if you possibly can.
Absolutely. Yeah. Thank you for that. You and I have both been in this industry for a number of years now. It's quite a long time, compared to the overall duration of the industry. What have you ever seen anything like this?
No, really, I haven't. I've seen three types of big picture challenges in the industry. First are big economic downturns. Second would be challenges that come from new technology. Those things are things that we have. And then there's competitive challenges that will affect specific industries. But I've never seen anything like this, because in those cases you had at least a bit of time to think and to adjust. In this case, for many people, it's been hitting like a ton of bricks. In the space of a few days, certain people had to empty out their centers. It was unprecedented. So I've never seen anything like it. And good management means getting good results when times are normal. It takes great leadership to inspire and move people forward in times like these. So that's what I would encourage everybody who's listening to this to aspire to, is the leadership.
Okay. Now, for many organisations, they're being forced to, in many cases, they're being forced to have all their staff working remotely. What do you believe are the long-term prospects for centralized contact centers?
Okay. Well, Roger, if you mean brick and mortar centers, I think this event is going to accelerate the use of multiple centers. Okay, instead of having all your eggs in one basket, one central center, and especially the use of at-home agents is going to be encouraged. So, employers who've traditionally been brick and mortar bound are going to start tasting the delights of at-home savings and workforce management flexibility. Let's keep in mind that with at-home agents, if you have a spike, you can call people up and bring them on without having to bring them in. Mm-hmm. That's a huge advantage. On the agent side, I think we did a research study called Agent Voices. It was a survey of over 5,000 agents. And the Agent Voices report indicated that commuting distance has a statistical impact on satisfaction. The shorter the commute, the happier in general the agent. And the satisfaction correlated highest to at-home agents. So there are good things to be said for many, if not all, employers and also many employees about the at-home model. Throughout all this, I would encourage people to think about the mental health of your people and your own mental health. As you go through these changes, you need to stay connected, communicate messages really that are affirming and comforting to your team. Let them know that you care. You're not sort of just pushing them out of the
Right.
center. You're staying with them and connected with them on a personal and spiritual level. So, obviously, when you do this at-home stuff, you have to make sure that it's done with proper technical security. But you lean on your IT services for that, using secure logins, multi-factor authentication, et cetera, to make sure that that part is taken care of.
Okay, good. And talking about good leadership, good stories and that, have you got any good stories that you can share? Things that have happened over the past few weeks that you've seen?
Yeah, there is. One of our clients faced an empty out your center order. It's sort of the opposite of an all hands on deck order that came because of both governmental, health authority and the central home office. And so instead of it's all hands on deck, it's all hands off deck.
Right.
That's what I had to do. So they went from 10% at-home agents to 60% in 4 days, and they're going to be at 100% pretty shortly. There've been a few normal glitches, but it's all gone remarkably smoothly. So I'd call that a good news story. Absolutely.
That's good. And Bruce, I understand you have some thoughts about screening for new agents and supervisors in this time of COVID-19.
Yeah, this is something that people may not have thought about, but they need to. And we had a call talk interview last week with Christine Kunin, who's a specialist in this area. And we've begun to see some court closures. Okay, so we're talking now about screening for new employees in many environments in many countries. So, some of the courts have closed so that that can impact access to court records that are not online. It's not bad yet, but delays should be anticipated. Slowdowns have begun in education verifications if you do that. And the same may soon be true for employment verifications if employers shut down or reduce staff. So that's something we need to be aware of, as that may impact on a very, I try to bring things right down to where people are managing, where they're living. As for drug testing, consider the fact that some of the same labs that do testing for applicants could become very focused on testing for COVID-19. So therefore, the pandemic may have an impact on your ability to get those timely drug test results. And just to make things a little more complicated, Christine mentioned that some people who are applying for an at-home job may simply refuse to go to a facility to be tested because they're afraid of infection. They may have an underlying condition, they may be on the older side, whatever that might be. So what's an employer to do if for one reason or another you can't get timely results?
Yeah.
Well, here, without offering any legal advice, you may have to show some flexibility until this pandemic's over. And that means you may bring the person on conditionally. That is on the condition that they pass the test when the results come in. And for those who are listening and who are outsourcers and they have contractual agreements that your people will be tested, what do? You may have to reach out to your clients and ask for a temporary waiver. And they shouldn't unreasonably withhold that because this is a situation of force majeure. There are also oral fluid lab-based tests where you administer the test on your site, but the applicant actually places it in a sealed bag so nobody else comes in contact with the sample, and then that's mailed to the lab, et cetera. So hopefully this is some good information for your listeners.
Interesting. Yeah, very good. Thank you. And Bruce, do you have any final thoughts to share with us?
Yeah. Let me think about a couple things. One is, I think we all need to remind ourselves that what we do in this contact center industry really makes a difference, especially now. Okay? Whether you are in banking, finance, healthcare, transport, insurance, government, nonprofit, other sector, you and your people have a real mission. It's to keep us all connected and to meet real human needs that need to be met. And So keep in mind that what you do is important, and bring that across to your people. That's an important message. Next, remember that the safety and health of your employees and your customers is the top priority.
Mm-hmm.
Keep that fixed in your minds as you're making decisions. And 3, unfortunately, you may be in a center that's suffering layoffs or will suffer layoffs as a result of coronavirus. So how do you address these situations with empathy and support? This would be the subject of another interview, actually, but just keep your best and keep in mind that some weeks or months from now, you may be back on the upswing in employment and wanting to get some of your wonderful colleagues back. So do it right so that you don't burn bridges.
Yeah.
Prepare for the worst, but don't forget the future recovery either. Finally, I'm hoping and praying that this pandemic ends as soon as possible. I'm dedicated to spread the word that we have to stop the spread of the virus. Raj, there's an old saying that leadership means never having an off day. Well, in this case, showing leadership is something everyone listening to this will need to do today and in the days ahead. So prepare, plan, nag nicely, of course, and execute on your plan so that when you come through the other side, you'll be stronger than ever. So really, my best wishes to you and to everyone out there. Please stay healthy and wash your hands.
Absolutely. And same to you as well, my friend Bruce. Thank you very much for your time. You stay safe as well and healthy, and we'll be in touch again soon. Thank you very much for all your comments. They were good. Really good.
Okay. Thank you, Raj.
Thanks a lot. Take care.
Okay, you too. Bye-bye.